My topic was all about the learners with difficulty moving and or walking. With definition, so when a child has difficulty moving and or walking, the physical domain of development is affected. Example of physical disability is first, developmental coordination disorder or dyspraxia. Second, stereotypic movement disorder. And the last is tics and cerebral palsy. So, developmental coordination disorder. It refers to significant and persistent deficits on coordinated motor skills that are significantly below expected typical development. So, it is a condition affecting physical coordination. It causes a child to perform less well than expected in daily activities for their age and appear to move clumsy. So, there are characteristics of developmental coordination disorder. So, the problems with movement and coordination are the main symptoms of DCD. So, the children may have difficulty with playground activities such as hopping, jumping, running, catching, and kicking a ball. So, they often avoid joining in because of their lack of coordination and may find physical education difficult. So, when to seek medical advice? So, saan tayo hahanap ng mga medical advice? So, if you're concerned about your child's health or development, talk to a GP or health visitor or speak to a nurse, doctor, or special educational needs coordinator at your child's school. So, if necessary, they can refer your child to a community pediatrician who will assist them and try to identify any developmental problems. So, meron tayong mga causes of developmental coordination disorder or what we call DCD. So, doing coordinated movements is a complex process that involves many different nerves and parts of the brain. Any problem in this process could potentially lead to difficulties with movement and coordination. It's not usually clear why coordination doesn't develop as well as other abilities in children with DCD. So, however, a number of risk factors that can increase a child's likelihood of developing DCD have been identified. So, sa mga causes ng DCD ay naka-include dito yung being born prematurely before the 37th week of pregnancy. Second, being born with a low birth weight. Third, having a family history of DCD, although it is not clear exactly which genes may be involved in the condition. And the last is the mother drinking alcohol or taking illegal drugs while pregnant. So, meron din naman yung mga treating of DCD. So, there are no cure for DCD. But, meron tayong mga number of therapies na kung saan is makatutulong sa mga bata on how to manage their problems. So, include na dito yung being taught ways of do activities they find difficult. So, such as breaking down difficult movements into smaller parts and practicing them regularly. Second, adapting tasks to make them easier, such as using special grips on pens and pencils so they are easier to hold. So, although DCD does not affect how intelligent a child is, so it can make it more difficult for them to learn and they may need extra help to keep up the school. So, treatment for DCD will be tailored to your child and usually involve a number of different healthcare professionals working together. So now, let's proceed the dyspraxia. So, used synonymously with developmental coordination disorder is a term often used by occupational therapists. So, dyspraxia is also known as developmental coordination disorder. So, it's a common disorder that affects movement and coordination. So, it does not affect your intelligence, and also it will affect the fine motor skills, such as writing or using small objects. So, may mga causes din ang dysprasia. So, it's not known what causes dysprasia, but you may be at a higher risk of developing it if you were born prematurely. So, dysprasia is more common in men and often runs in families. So, dysprasia have three types. So, first is motor dysprasia, causing problem with skills like writing, dressing, or skipping. Second is verbal dysprasia, causing problem with speech. And the last was oral dysprasia, causing problems with movements of the mouth and tongue. Treatment of dysprasia. So, occupational therapy, it is to help you to find practical ways to remain independent and manage everyday tasks such as writing or preparing food. Cognitive behavioral therapy or CBT, a talking therapy that can help you manage your problems by changing the way you think and behave. So, stereotypic movement disorder. So, is characterized by repetitive, seemingly driven, and non-functional motor behavior. So, this behavior interfere with social, academic, or other activities and may result in self-harm or injury, according to American Psychiatric Association 2013. So, such motor behaviors do not result from any other neurodevelopmental or mental disorder. So, this can be hand waving, body rocking, or head banging. So, the movements interfere with normal activity or may cause bodily harm. Stereotype movement disorder. So, primary motor stereotypes are rhythmic, repetitive, fixed, predictable, and purposeful. So, but purposeless movement that occur in children who are otherwise developing normally. Next is the stereotypic motor behavior. So, typical motor stereotypes may include activities such as thumb sucking, nail or lip biting, hair twirling, head banging, body rocking, self-biting, and teeth clenching or grinding. So, this behavior typically resolve in childhood, but some may persist into young blood. So now, let's talk about the stereotypic movement disorder treated. So, first is behavioral therapy and cognitive behavioral therapy may be able to help with stereotypic movement disorder. So, behavior therapy can help person recognize the patterns in their movements and offer positive reinforcement to help a person reduce or stop the movements. So, next is the cerebral palsy. Refers to a disorder of movement and posture that results from damage to the areas of the brain that control motor movement. From Clark et al. 2015. So, cerebral palsy is a group of disorder with multiple causes, so that results in impaired function of the developing brain. Types of cerebral palsy that your child may be suffering from include: spastic cerebral palsy leads to stiffness and movement difficulties. Second, athetoid cerebral palsy causes to involuntary and uncontrolled movements. Third, ataxic cerebral palsy leads to a disturbed sense of balance and depth perception. And the last is hypotonic cerebral palsy, low tone and motor impairment. So, meron tayong treating cerebral palsy. Pediatric Neurology Associates has many years of experience in treating cerebral palsy. So, when treating cerebral palsy, you will not only need to help of our practice, but you will also need to help of other medical professionals. So, some of the most common forms of treating the effects of cerebral palsy include surgery, physical therapy, therapy for social and emotional development, medication, speech therapy, specialized education. So, meron din tayong tinatawag na tics. So, tics are sudden repetitive movements and sounds that are difficult if not impossible to control. So, if your child or adolescents experience sudden uncontrollable behavior like this, so you are likely asking yourself, so, what are tics and how do we handle them? So, meron din tayong mga pediatric neurological associate na kung saan ito yung tutulong para ma-determine if your child is suffering from a tic disorder. So, like Tourette's, as well as provide them with guidance on how to reduce the effects these tics have on their life. So, if your child is repeatedly doing any of the following, so they may have a tic disorder. So, kung meron sila nito, nose wrinkling, head twitching, eye blinking, lip biting, facial grimacing, obsessive touching, kicking, jumping, throat clearing, grunting, sniffing, and coughing. There are different classification of cerebral palsy. So first is monoplegia. So when we see this, only one limb is affected, maybe upper or lower. And also, it is a type of paralysis that impacts one limb, such as arm or leg on one side of your body. So, look at the sample picture. So, that is the example of monoplegia. So, this happens when damage to a part of the nervous system disrupts nerve signaling to the muscles in the affected limb. Second is the hemiplegia. So, two limbs on the same side of the body affected. Ito yung condition caused by brain damage or spinal cord injury that leads to paralysis on one side of the body. So, based on this picture, hemiplegia, ito yung my brain, tapos meron siyang area of brain deprived of blood. So, meron din siyang blood clot, internal carotid artery or blood supply to brain. So, ito yung nag-supply ng blood sa ating brain. So, meron din siyang paralysis to arm and leg on one side. So, ito yung mga causes weakness problems with muscle control and muscle stiffness. So, the degree of hemiplegia symptoms vary depending on the location and extent of the injury. The third was the triplegia. So, three limbs are affected. So, it is a medical condition that is considered an incomplete spinal cord injury in which three limbs are paralyzed. So, put another way, the condition causes loss of sensation and movement in one arm and both legs. So, next is the quadriplegia. All four limbs, both arms and legs are affected. So, movement of the trunk and face may be also impaired. So, the most common cause of quadriplegia is an injury to the spinal cord in your neck, but it can also happen with medical condition. So, kung ating makikita sa larawan, ng example of quadriplegia is meron siyang mga affected body na dulot ng pagka-paralysis nito. So, una-una talaga dito is yung brain. Second is the cervical spine injury. Third, nerve supply to arms. And then next is spinal cord, nerve supply to legs, and the last was the paralysis of the body from the neck down. Next is diplegia. Legs are affected, less severe involvement of the arms. So it is refers to symmetrical paralysis. So usually affecting either the arms or the legs. So it is the most common use of paralysis in children, but can affect people of many age. So unlike other forms of paralysis, diplegia is highly unpredictable and may get better, worse, or radically change with time. And the last one is the double hemiplegia. So impairment primarily involves the arms, less severe involvement of the legs. So indicates all four limbs are involved, but one side of the body is more affected than the other. So the last one is the identification. So for developmental coordination disorder, so it is identifying children with motor difficulties, begins with family members and early childhood practitioners. Signs of developmental coordination disorder. So for the developmental stage, ito yung early childhood. So meron siyang mga signs, difficulty in tying shoelaces, buttoning, using spoon and fork, and getting dressed, problems in jumping, skipping, catching and kicking a ball, a higher tendency to bump into things, to fall over or to drop things. So, and that was all my report.